Welcome to the business model innovation of Temple Health University Hospital System. Founded in 1892, Temple University's hospital mission is to provide access to the highest quality of healthcare in both the community and academic settings. Since its beginning, Temple University has functioned as a traditional general hospital, with the majority of its proceedings from patients coming from Medicaid, Medicare, and charity cases. Only 20.7% of the patients have commercial insurance. This business model has put a strain on the functioning and the survival of Temple University Health. We proposed Temple University Medical Center innovate its business model so it can still support its mission but also gain prestige and a financial footing. First, we must look at the jobs to be done. Why would a consumer need hospital or health care? The three main reasons are to treat emergencies, relief of pain and suffering, and improve vitality. Why would Temple University Health want to be swimming through a red ocean of other general hospitals when it could be swimming in a nice blue ocean free and by itself? To do so, Temple University Health must look at the long-tail niche markets while also fulfilling the customer's jobs to be done. Should Temple University try to be everything to everyone, juggling things imperfectly? Or be the best at one area of medicine? But we're not the only ones with this idea. Specialty hospitals are expected to have a compounded annual growth rate between 2018 and 2025 of 5%, going from a $95.67 billion industry to a $119.89 billion industry. Getting in on the ground floor is essential. What is one of Philadelphia's biggest needs? Unfortunately, they have one of the highest rates of diabetes in the nation at 15.4%, while the national average is only 12.3%. Not only that, but the surrounding neighborhoods of Temple University Hospital have some of the highest rates of diabetes in the city. Though there are specialty hospitals across our nation, there are none that are dedicated to diabetes. Let's take a look at the customer journey. How does a customer find out that they need diabetic care? This can happen through a new diagnosis from a physician or healthcare worker, or a complication from the disease. If the patient is experiencing any pain and suffering or lack of vitality, they may also become aware of it through family members who've been diagnosed, word of mouth, or coming across information about the disease through media such as television, radio, magazines, or social media. Consumers then become interested and may search the web for more information. They may get referrals from their physicians. They might still go by word of mouth. They may look for testimonials online. They take this information that they've collected and they use it to make a selection. Their selection is going to be based on their research, once again, word of mouth and reputation, their physician's referrals, the hospital's reputation for the number of top doctors, its reputation for specialty in a specific area of care, its involvement in research, its involvement in the community, the hospital's reputation, a patient's great experience, high level of care will not only continue to keep that patient in the system, but will also add to word of mouth referrals and growth of a medical program. Temple University Health System can look at the customer's journey and help to build its programs around it to support its patients and customers. Performing a SWOT analysis of a diabetic hospital, we look at the strengths of Temple University Hospital System. They already have a pre-existing functional hospital. It wouldn't take very much for them to pivot to become a specialty hospital. Their weaknesses they are located in an area of Philadelphia that have some safety concerns. This may drive away consumers from outside of the area. But their opportunities are that there are no diabetic hospitals in the Philadelphia area, let alone the country. And building a reputation on diabetes will strengthen the brand and recognition of Temple University Health. Threats include other area hospitals have diabetes program that may rival that of this developing Temple University program, or other hospitals may choose to open up a diabetic specialty hospital. The 6 Thinking Hats is a tool that we can use to help us decide if this is a good business journey. Under the first topic, process, having a diabetic hospital would be a good idea because we have the largest population of diabetics in the nation. Feeling that people get from a diabetic program would be relief from those who are suffering from diabetes and looking for expert care. The facts, if this program doesn't succeed, you wouldn't lose much, since starting this program up in a lean fashion doesn't require that much of an output. The benefits would be that Temple University would gain national recognition, prestige, thus attracting more patients, experts, researchers, and funding. The creativity aspect, taking a traditional hospital and turning it into a specialty hospital. One of the cautions, there's a 5% increase in compounded annual growth rate expected, so we may not be alone in this endeavor. But there are some assumptions we need to look at. First of all, would doctors be interested in sending their patients or working for a diabetic hospital? This can be tested through interviews or sending in a survey. The survey could be completed at staff meetings or as a prerequisite for privilege renewal. The other assumption we need to be looking at is, would the community be open or interested to a diabetic hospital? Ways to test this can be putting up a diabetes hospital landing page, interviewing patients at a dialysis center, giving a free infographic with a download in return for an email sign up, post a free ebook on managing diabetes as a download and track downloads. Use social media to create an account that has diabetic health tips and we can assess engagement. Host a contest for a free blood meter. Set up community health screenings and tests and see how many people show up. Using Lean Startup, it would not be very difficult to get this program going. Number one, creation of a landing page or a separate website with diabetic information. Creation of a new diabetic hospital logo to be placed on pamphlets and business cards, advertising, and even changing the name on the sign outside to the Diabetes Hospital, Temple University. Starting in a lean fashion and using some of these testing techniques will allow Temple to build its program. As a program builds, it can add additional services such as satellite offices, mobile units that go into the community and treat non-urgent outpatient care. As we look at it, creating a diabetic hospital creates virtuous cycles. Diabetes can affect all areas of medicine, and therefore each department in medicine will feed back into the diabetic program, from things like transplants to heart disease, ophthalmology, urology, pediatric, maternal care. Supporting the local community will feed back into the diabetic program and increase its reputation. Providing access to the community will support the community and also feed back into the diabetic program and its reputation. As a reputation increases, it'll attract more doctors and researchers, which will further increase its reputation, attracting customers from outside of the area. As a reputation increases and we see more top docs, top researchers, the hospital will then generate more funding and more donations, and the virtual cycle goes on and on. It is our recommendation that Temple University Hospital consider the business model pivot, going from a general hospital to a specialty hospital. This business model pivot will mainly change the value proposition, but in turn will have great effects on its customer segment, revenue streams, and also its key partners. For example, the American Diabetic Association has an office in Pennsylvania, along with the Delaware County Juvenile Diabetes Research Foundation. Temple can consider partnering with local restaurants to create a restaurant week where restaurants serve diabetic healthy food. These joint ventures will support both the hospital and the restaurants. Teaming up with sports teams, which Philadelphia has many, to do community outreach and bring awareness. And the list goes on. We are confident that the business model pivot from a traditional hospital to a specialty hospital will not only bring success for Temple University Hospital, but will also bring jobs, support, and recognition to the city of Philadelphia and its community.